my name is Lauren Alexander, and this is my checkoff for my Foley catheter insertion on a nail. So first I would start off by verifying the provider's order, and then I would do hand hygiene. And then I would knock on the door. Hi, my name's Lauren. I'm going to be your student nurse today. I'm going to be doing a Foley catheter insertion on your penis. Should only take a few minutes of your time. Do you have any questions? Thank you. Can I please see your armband? Can you tell me your name and date of birth? Do you have any allergies? Are you in any pain? If the patient has no pain, I can go ahead and get started. If the patient is in pain, I would need to administer pain meds and then reassess in 30 minutes. So first thing I would do is check the packaging on my kit for an expiration date. And the date that I have is 7/8/2022, so I'm good there. So then I would make sure I have my trash can, which I do. It's over here. Then I would do hand hygiene and put on clean gloves. After applying the gloves, I would make sure that the patient is in the correct position for this procedure, and I would just make sure that he's comfortable and that his legs are out so that I can access his penis. Then I would need to take soap and warm water and clean all around the perineal area. This patient doesn't have foreskin, but if he did, I would need to retract it and clean underneath. Once I'm done with that, I'll take off my gloves. And before I took off my gloves, I would need to make sure that I had located the meatus and covered the perineal area. So then I would take off my gloves, throw them away, do hand hygiene, and then I could start opening my kit. Then I would need to take this. And then I would carefully place underneath. And I would have the patient lift their bottom so I could scoot it under. So then I would do my sterile gloves. And my mask is fogging up. And I don't know if you can see this on camera, but I'm applying my sterile gloves here. Be very careful not to break sterile field. Okay. Okay, I already broke sterile field, so I would need to start over. But for time purposes, I would have another set of gloves and I would just be able to start over. So I would do hand hygiene, reopen my gloves, and put them on, making sure I'm not breaking sterile field. Okay. And then I could throw that away. So then I would need to tie in my box. So I could go ahead and get I don't need pliers. So I get my swabs ready. And throw that away. And actually, before doing the swabs, I would actually do the saline first. So throw that away, and I would need to remove the plastic on this part and throw that away, and then attach the saline to the catheter so that it's ready to go once I'm finished. Then I would go ahead and get my swabs ready, put them out, and then I would put my lube in the container. Next, I would take this and dip it in the lube. And then I would bring this over here and drop it, maintaining sterile field. And then I would let the patient know that I'm about to go ahead and insert, just so to take a deep breath. And then I would go ahead and insert the tubing until I see urine. Okay, so I see urine coming out. So I would advance it another 1 to 2 inches. And then once the tubing is about 1 to 2 inches in, I would then go ahead and inflate the balloon. And then to make sure that it is in place, I would then need to give it a little tug. And yep, it's in place. So once I'm finished, I would then need to make sure that I'm holding on and securing the catheter to the patient's leg. And then I would need to take the collection bag and put it at a level that's below the bladder, where it won't move, to make sure that it's secure. So then I would assess the patient, make sure that he's comfortable, and then I would need to clean up all of my mess. And then once that's done, I would lower his bed, put his side railings up, make sure that his head is elevated, give him his call light. So lower bed, the rails are up, elevating the head, call light, and then after that I would just make sure that he's doing okay, see if he needs anything, if he's in any discomfort. And then afterwards I would go and document. So I would need to document the catheter size, the type of the catheter, the color of the urine, and the consistency. And then I would document like the urine output after the insertion's completed. Thank you.